All right, so we continue to actually look at the various joint issues, right? That's like issues that could actually cause inflammations around your joints, cause all those joint stiffness and all of that. So the next one which we are looking at is a pseudogout. Or some people say gout. I don't know. I'm not here to teach English, right? I'm here to teach orthopedics. So for this one, it's also known as what? Acute. Okay, CPPD is what? Calcium Pyrophosphate Deposition Disease. So from defining the terminology, when we say something is acute, this happened all of a sudden, right? So it's also known as pseudogout. So for what we have here, you could actually observe this, this picture, and you can see that there's a deposition of the calcium pyrophosphate deposits in the joint. Okay, this will cause inflammation. This could cause your joints to become stiff. So just so you know, it's commonly known as pseudogout. It's a joint condition. It mimics gout. Do you understand? It's not the real goat. That's why we say pseudo. Pseudo is looking like. Okay. So it is actually caused by different types of crystal. Do you understand? Not the one that gout is caused by. So what is it? CPPD is calcium pyrophosphate deposit disease. Okay. It involves buildup of the calcium pyrophosphate crystals in joints. So joints, most of the times you see them talking about the knee joint. Now this is because the knee joint is mostly affected by this. You understand? So these crystals can trigger a lot of inflammation, leading to acute what? Okay, CPPD crystals arthritis. Do you understand? That's the one we are talking about. Do you understand? Because of the deposition of calcium pyrophosphate deposits. So it's called pseudo because it resembles goat, but it's not a real goat. Goat is formed by goat problems is caused by what? Uric acid crystals, not calcium pyrophosphate. You understand? So hence the name. So symptoms is there's severe joint pain and stiffness. Alright, the person is not able to use the joint like they used to. Alright, the person is not able to use the joint like they used to. There's swelling and redness over the joint, fever and general malaise in some cases. So it most commonly affects the knee. That's why we are always having the knee. But just so you don't forget that it can also affect the wrist. It can also affect the shoulder. It can also affect the ankle. It can also affect other joints. Okay, so pseudogout. So causes and risk factors. Okay, that's like what could actually make you to actually have this easily. All right, so in people over 60 years, if you have joint or joint trauma, that's like direct injuries to the joint, or maybe I've had surgeries in the joint. Okay, then you're now having like a side effect of the surgery. Okay, so other conditions like hyperparathyroidism, hemochromatosis, hypomagnesemia. There's sometimes genetics is rare, but sometimes it actually runs in the families. Okay, then osteoarthritis. Okay, so diagnosis is we know what is causing it, so you're actually trying to dictate it. Okay, that's crystal pyrophosphate. Okay, calcium pyrophosphate crystals, right? I was kind of like trying to switch it up. So of course you have to actually dictate that, so you can be able to differentiate this disease condition from gout, from rheumatoid arthritis, then also from osteoarthritis. So treatment, non-steroidal anti-inflammatory drugs like ibuprofen should help you reduce the pain and inflammation that comes with this. Okay, colchicine and corticosteroids, you use this for cases that are actually going crazy. Okay, but no current treatment removes the crystals. Do you understand? But you just have to manage all those symptoms of inflammation and pain that the patient is feeling.